We're here today with our patient Ari. Ari's complaining of some back pain and neck pain, and we're going to check her out and see what she has. Ari, push up. Good. Push up. Good. Push up. Good. Go. Good. Ari, push out for me. Great. And push out. Ari, don't let me pull. Good. And don't let me pull. Good. Push towards me. Go. You can come in, Andy.
Oh, okay.
Just
I saw
make
you
sure.
videotaping.
Yeah, no worries. Alright, bring this foot to your back. Go. Good. Relax for a second. Try again. Go. Alright. Again. Again.
What does rubbing down the spine do?
That's called the gallant reflex. When you do that stroking kids under the age of 6 months, it should cause this quad to facilitate, and the child will roll up like that.
Huh.
Okay, so we're using chiropractic for muscle testing. We're going to stroke here. That should cause this muscle to facilitate, be strong, which means this muscle should be weak.
Huh.
So on this side, I'm stroking here. This muscle should be weak. It's not. So now we're going to look for a reflex or a joint or a muscle or something that's out.
I thought you were always looking for it to be strong, like that was the good thing.
It is in certain situations, but not in others. It depends on the test.
Huh.
Try again. So, people that are having stress issues, we don't want their reflexes to be strong all the time.
Yeah.
But just like with your brain, you don't want it always too active. That can have health problems too. You need it to calm down and shut down so you can sleep or whatnot.
Yeah.
And that's the same for joints.
So,
Oh my God.
having like lots of anxiety and like stress, what affects the most in your body?
So as a chiropractor, my modality for treating the brain is going through the body. Like I treat her body to fix brain and to calm the brain down. And a massage therapist does that, and a physical therapist does that, and acupuncturists do that, exercise physiologist, your personal trainer, that's what they all use. So we all use the body. And other physicians use the brain, use medications or cognitive therapy or whatnot. So stress produces cortisol. Cortisol is a glucocorticoid, which damages an area in the brain called the hippocampus. It damages the brain collectively because it damages dendrites, which is how our brain communicates with other neurons. When you have increased stress hormones, you use up more B vitamins, you decrease the body's ability to repair. You can cause ulcers in the stomach.
Oh wow.
It impacts sleep. It decreases your sex hormones, which has an impact on your mood, right? Of course, it can cause depression. Let's see what else. It changes pigmentation in the hair. So people who are stressed out age faster. They get gray faster. It damages the skin.
Oh, it does?
Yeah. So,
Are there?
and then that's just the physiological portion, but you're also asking physically. So obviously people when they get in a stress state, which is like chronic fight or flight mode, then you're talking about stress and tension in their shoulders. You're talking about their entire back.
Oh, my back's so messed up.
Can stress and anxiety produce physical pain?
Absolutely. Just like we're talking about, if you have too much stress in your back and your shoulders,
I've been having a lot of bad headaches lately.
so these are
Yeah.
tension stress headaches, right?
Yeah,
Probably.
I think so.
And then you have something called the cervicogenic headache. That's where the headache's caused by the neck.
Interesting.
So I'm increasing the pressure. If you're okay, let me know, but it's just to...
No, it's fine. I'll tell you if you're hurting me.
Are there certain foods that can cause stress or anxiety?
Yes. I'm going to pull you towards me. I won't let you fall. You're making this arm.
Yeah, I've noticed that it's been like 2 weeks. You know, I would imagine I've been under a lot of stress after my friend passing away.
Oh, yeah.
So I've noticed, especially the last few days, where I'm short of breath and my chest is hurting. And yeah, I'm like really shaky, and that in itself gives me more anxiety because I can feel it.
Well, I'm telling you, so we have a mental trigger, right, which is stress. We have a chemical trigger, which is your diet. And then for you, lupus, which is an autoimmune condition, so your immune system's being driven by a trigger. And I think for you it is wheat or dairy or some other food source. So these things are causing you to have your flare-ups. You're not making neurotransmitters to calm you down. That means you're chronically stressed, a neurogenic stress. You're making pro-inflammatory chemicals because of this diet, which makes you hurt and pain all the time.
Yeah.
And then you can't work. That's normal. So these reflexes, for example, are normal now, and they were not normal last time. Push out.
So does
Alright,
that mean
push
she's
out.
improving
It means she's getting
care?
closer to normal. Go. Good. And then try this one. Go. And if we can get her system to be closer to normal as a chiropractor, I can calm her down. That's the goal. So she leaves here with less stress and she's calmer. The reason we went to her low back first is because all her reflexes are not making sense. All right, try again. Go. Okay, so that's more normal. All from a low back adjustment. Try again. All right, go. Push towards me.
Oh.
Go.
I already feel a lot better, especially in my upper body.
So, just sit for a second, all right? How are you feeling?
Good.
Feel calmer?
Mm-hmm.